When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Christian Moises. St. Tammany Parish Hospital is proud to be a leader, or the leader, in healthcare technology on the Northshore, and we have a trio of physicians on today's show to talk about 3 procedures that are unique to the Northshore, all of which are almost exclusive at St. Tammany Parish Hospital. First up, we have Dr. Kevin McLaughlin. Glad you're here. You are an ENT. And head and neck surgeon.
Yes.
Doing a lot of awesome things at St. Tammany Parish Hospital.
Yes.
We'll jump right in because I know you got a lot to talk about. You just recently performed a pretty rare case, actually the only one in Louisiana, if I'm correct.
Really interesting case. We had an unfortunate circumstance with a young lady who had a non-cancerous growth around her eye and actually around the nerve that goes to the eye. And as this bony growth has gotten larger, it actually was strangling the eye, and she started to lose, in fact had lost a significant amount of her vision. Her treating ophthalmologist or eye doctor referred her to me to see if we could possibly remove the bone from around the optic nerve. And that's exactly what we did for this young lady. I actually saw her at another clinic that I have, but brought her specifically to St. Tammany Parish Hospital because we have a great instrument that does a wonderful job in terms of removing this type of a growth without damaging the surrounding structures, and in particular damaging the nerve, because if that does happen, she would lose her vision, and that's what we're trying to preserve.
Now I know we're going to see a little demonstration of what this equipment can do, but do you want to maybe give a little bit of explanation of what exactly it's capable of doing?
Yes, so this device is called the SONOPET. It's a device made by a company named Stryker, and it's very similar to a drill, but anyone that's had experience with a drill, as the drill is removing the bone, for instance, it can cause some collateral or surrounding damage, either directly by cutting into that material, or it can actually cause the surrounding tissue to get so hot that it actually burns the surrounding tissue. So the neat thing about this device is that it will remove something so incredibly hard like bone that is right next to an incredibly fragile nerve and not damage the nerve at all, which is really cool. So I have an example. The first time I was exposed to this device was at a trade show, and they actually had me remove the hard casing of an eggshell without cutting through the membrane that separates the hard part of the eggshell from the contents of the egg. And so it's a great demonstration of how this device can remove something very hard without damaging the something very soft or delicate right next to it. So that's what we're going to do right now.
Awesome.
So we'll stand up and show you what we're talking about here. So this is our SONOPET device. It looks a little bit like a drill handpiece. So I'm going to step on this pedal. This is an egg, and we're going to And so this egg is obviously a brown egg. So as we get through the outer part of the egg, we get rid of the colored part. And as it gradually removes the bony part of the egg, now you can see that the hard part of the egg is gone, but this part right here is the soft membrane that separates the hard part of the egg from the internal part of the egg. But for example, if I put this on my finger right here, it was just then cutting the hard part of the egg. I can put this right on my finger, and it won't hurt the soft part of my finger. But if I flip it over and I touch my fingernail, if you can see that, it'll start to take away my fingernail. Now that's an expensive way to remove your fingernail, but it illustrates the point that it's an incredibly powerful instrument that can do something very strong next to very delicate structures.
And not only does it look extremely precise, it looks pretty quick.
It's fairly quick. In addition to an ear, nose, and throat doctor removing bone from the facial bones or the around the eye, some of my other colleagues in particular, like orthopedic surgeons or neurosurgeons, will use this same device in spine surgery. The other scenario where this device can be indispensable is actually in removing brain tumors. A brain tumor will have a certain consistency, and then the surrounding brain has a different consistency. And what's really neat about this device is that it will remove the brain tumor without damaging the surrounding tissues. And those are really the main two scenarios, I think, where we use this device and where we use it at St. Tammany Parish Hospital.
I was going to ask, how common is this procedure now, and is this kind of a new procedure, a new technology that you're going to start to see more of for patient care?
Well, the technology is new, but its applications have been present for quite some time. And what I mean by that is you use this device in anywhere where you'd be removing bone. So there are a lot of instances where we're having to remove bone. We may choose to use this device in lieu of or in replacement of a drill because it has less collateral injury or less collateral thermal damage. That's the one way of describing it. Right. So its applications should increase as people consider a way to try to do what they need to accomplish, like with spine surgery or with brain surgery or with skull-base surgery, and they're wanting to limit the collateral or surrounding injury to these really important structures that happen to be around the skull and around the spine.
And in addition to that ultra rare case that you did, we've done other cases using the Sonopet at St. Tammany.
We have. I mean, while it's not as life-threatening or life-altering like losing one sight, but another individual that had a bony growth within their nose, historically we would have just removed the growth, which would have also removed the lining of the nose, which is important. The lining of the nose helps warm the air, moisturize the air, and filter the air. And if we can't preserve that lining, you lose some of those functions. The neat thing about this device, it enabled us to not sacrifice the lining so the person's nose could still do its job. So we were able to remove the tumor without sacrificing the function of the nose. In the past, we would have lost function of the nose.
And again, this is minimally invasive, so recovery time, I imagine, is fairly quick compared to what it's been in the past.
Exactly. The young lady that had the problem with the optic nerve, she actually was from Acadiana and had traveled several hours to come to St. Tammany Parish Hospital, and we actually kept her overnight in the hospital, but if she had lived in our community, we would have let her go home the same day.
That's crazy, because a traditional procedure would have required...
She would have been in the hospital several days to a week.
Yeah, that's impressive.
Yeah, great stuff.
Well, Dr. McLaughlin, always great having you here. Always interesting stuff, doing great, very advanced technology. Glad to have you at St. Tammany Parish Hospital, of course. We'll be right back to talk about another groundbreaking procedure that is unique to the North Shore and exclusively performed at St. Tammany Parish Hospital.
For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Christian Moises. State-of-the-art technology continues to set St. Tammany Parish Hospital apart as the leader in healthcare on the North Shore, and our next guest is performing a procedure that is exclusive to St. Tammany Parish Hospital, again on the North Shore. Dr. Philip Jenkins, a gastroenterologist on staff at the hospital, has been performing GERD treatment for the past 6 months, bringing relief to patients who suffer from chronic acid reflux. Dr. Jenkins, thanks so much for being with us today.
Thank you for having me.
Let's talk a little bit about exactly what GERD is. Mentioned acid reflux, kind of one and the same?
Yes, so what GERD is gastroesophageal reflux disease. And in the simplest terms, what happens is contents that should be in the stomach reflux back into the esophagus. And this happens due to a failure in the normal barriers that prevent reflux. The problem with GERD is that over time it causes complications and it can do damage to the esophagus that lead to ulcerations, bleedings, strictures, difficulty swallowing. It can lead to a condition called Barrett's esophagus, which can ultimately lead to esophageal cancer.
So definitely it's not just heartburn. It's
heartburn.
a lot more than regular heartburn.
It's something that you need to look into.
Explain the differences there's different types of GERD?
Well, they're different symptoms that you can get with GERD, and I did want to show, there's one illustration that I think will show this very well. If you look on the illustration, what you'll see is a patient that is having reflux. So the bluish material is gastric contents, and that contents is going into the esophagus, and there it will do its damage. If you look at our other picture, what you'll see is a normal stomach, and you can see that the blue material is staying in the stomach and the esophagus has nothing in it. If you look at the barrier, that thick muscle at the bottom of the esophagus, which is the tube leading down into the stomach, you can see that it's very thick. And that thickness allows it to hold its tone and its strength, and it actually keeps the stomach contents in the stomach and out of the esophagus.
And what you're doing is the treatment that you're providing gets us from the one that's on the right, where the tube is not as tight, back to the way it's supposed to be on the left, and correct.
Right, yes. That's so basically the Stretta procedure takes the muscle and we put a little bit of radio frequency energy into it, and that makes the muscle strong and it thickens it up and it provides that barrier that's been lost.
And I think we have a little video actually to show everybody how that exactly works.
So if you look at the video, what you'll see is that the catheter goes into the esophagus and the balloon is being inflated. The balloon is inflated to hold the catheter into the correct position. Once the balloon is inflated, 4 small needles go into the muscle, and there we deliver our radio frequency energy. We do it at 4 positions in the esophagus, and we go into the stomach, and we pull it back into the very top part of the stomach called the cardia, and there we deliver it in 2 positions.
And again, this is a painless procedure. They wake up, they feel very little discomfort after because it is minimally invasive. It's kind of in and out. It's
minimally invasive. Some patients state that they actually have a little bit of discomfort and it feels like the reflux again. But that's about it. That little bit of reflux that they describe, that reflux feeling, lasts for about 24 to 48 hours, and then typically no more pain, no more problems, and they start to see relief a little bit initially, but it takes a full 2 to 6 months for that muscle to really remodel itself and for the full thickness of the muscle to come about, and thus you are reinstituting a barrier that's been lost.
Now, who's a candidate for this kind of procedure?
So candidates for this procedure are anybody with reflux. There are a few things that would not allow us to do the procedure, and that would be a large hiatal hernia. The balloon on the catheter is about 3 centimeters in diameter. So if your hiatal hernia is bigger than that, then the catheter is not meant for your anatomy. So really, our cutoff is typically around 2 centimeters, just to make sure that the procedure is going to be successful.
Now I want to kind of take a step back. I know, and we were talking before we went on air, this is a great procedure. There are also other medications and options for people with GERD.
Yes, there are. So we'll go over the GERD treatments, and they're essentially, there are 4 steps in the treatment of GERD. The first is lifestyle changes. The second, medications. The third is the strut procedure, which we've talked about. And the fourth is invasive surgery. Invasive surgery includes doing a LINX procedure, which is a ring of magnets that can reconstitute that barrier. And the other being a Nissen fundoplication, which is a wrap, when you actually wrap the top of the stomach around the bottom of the esophagus, and that also will give you a barrier. So we'll start with our lifestyle changes. You'll see several of them on the screen. The ones that I think are probably the most important, that I get the most bang for your buck for, are losing weight and avoid eating meals within 3 hours of going to bed and eating small meals. Another thing is food triggers. In this area, fried foods, avoiding fried foods is important, and things that are tomato based.
I'm going to say Bloody Mary's not good.
Yes, that's exactly it. And if lifestyle changes don't get the desired effect, we usually go to medications. And it starts with over-the-counter medications like Tums that you would take as needed, and then H2 blockers, such as Zantac. But the mainstay in therapy are the PPIs, the proton pump inhibitors. And that's Prilosec and Nexium are the main ones. Those are examples. Dexlant's another one. And that's what most gastroenterologists use to help control GERD.
So that would be, talking about the course of action, you would encourage a patient probably to start with those medications first, make those lifestyle changes. Not getting better, we're going to move on to Stretta.
Yeah, we go on a stepwise approach. So from the first step of lifestyle changes on to medications, and then we go on to Stretta from there. And in some patients, their reflux is actually controlled with the medications, but they've opted to not be on a medication for the rest of their lives. And for those people, Stretta is perfect too. It's not just the people who aren't fully controlled with the medications, it's also people that are controlled, but they've decided to not be on a medication forever.
And after Stretta, you mentioned about invasive surgery.
Yeah, so one great thing about Stretta is we're not cutting anything out or permanently changing the anatomy of the patient. We are reconstituting what was there to begin with by making that muscle stronger, but it doesn't preclude them from having any surgeries in the future. So the fourth step of GERD treatment, the invasive surgery, you can still do that if you've had Stretta. If you do Stretta and you do not get the desired results, you can still go on to a more invasive procedure. Also, if you've had the invasive surgery and it's not working any longer, you can do Stretta after the invasive surgery. It still works.
It can be done at any level, really.
Mm-hmm.
It's some good news then,
yes.
in case you're hitting roadblocks everywhere you go.
Right.
Is there anything else that you would tell a patient that is considering this, that may have some symptoms of GERD, that wants to look into Stretta?
I would just say that it's a very effective procedure. It's minimally invasive. Takes about an hour, a little less than an hour to do. And the results so far are great. We have good 10-year studies that show that the results last up to 10 years. Now, our data doesn't go much past 10 years right now, but the 10-year data really looks great. So this is a long-lasting procedure that is minimally invasive and has got few complications associated with it that is really helping a lot of people.
And the best part is, for Northshore patients that are suffering from these issues, the procedure is exclusive at St. Tammany Parish Hospital on the Northshore. So you don't have to drive the bridge. You can go
right
just
here.
a couple miles over to the hospital and take care of it.
That's right.
Well, Dr. Jenkins, thanks so much. We're glad to have you here. Great information. And we'll be back shortly to talk about cardiology care that is also unique to St. Tammany Parish Hospital.
When it comes to your family's health, you want the best. That's exactly why St. Tammany Parish Hospital and Ochsner are now working together. By uniting two of the highest quality healthcare organizations in the state, we can bring everyone in St. Tammany Parish a higher level of specialty care with advanced procedures and the most advanced technology. Because when your healthcare is better, so's your life.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. As if innovative ultrasonic surgical technology and acid reflux treatment exclusive on the Northshore at St. Tammany Parish Hospital aren't exciting enough, Dr. Sohail Khan, an interventional cardiologist with Covington Cardiovascular Care at St. Tammany Parish Hospital, is here to talk about a novel approach to heart catheterization, which he likes to call the new route to the heart. Thank you for joining us today, Dr. Khan.
It's good to be here.
Now, I say the new route to the heart, but it's actually radial artery catheterization.
That's
what
correct.
exactly does that mean?
Well, there are millions of heart catheterization or heart angiogram are performed every year, and the most common route is through the right groin, where the cardiologist threads a small tube, which we call catheter, through this artery, which we call femoral artery in the groin, all the way into the heart to diagnose heart attack or blockages in the heart. Now, it's the same procedure. The only difference is that the route is different. So instead of going through the groin, we are going through the wrist, through the small artery in the wrist, which we call the radial artery.
This is clearly new technology, a
Right.
new way of doing it.
Right.
There's got to be a reason why we want to go through the wrist.
Well, there are several complications associated with the groin approach. First of all, the femoral artery is a big artery. So there are more bleeding complications. So if bleeding occurs outside the skin, it can lead to hematoma and bruises and discomfort that can last for days and days. If bleeding occurs inside the abdomen, it can really endanger life. And then if someone who has back issues, sometimes the patient has to lay in bed for anywhere from 4 hours to 8 hours. That can be very discomforting. And then there are studies after studies which have shown that radial artery access is superior than the groin access. It actually improves the survival in patients. So those are the reasons that we are really pushing for this new route to the heart at St. Tammany Parish Hospital.
This is a fairly new procedure that we're doing, but
Right.
St. Tammany Parish Hospital is becoming a radial first
Right.
Hospital.
Right.
What does that mean?
That means that we are the radial first cath lab in the Northshore. That means if any patient walks into our cath lab, whether it's an acute heart attack or if they're having chest pain and they need a diagnostic angiogram, the radial artery access is our first option. And we will try to avoid the groin access because of the obvious complication and disadvantages that I just described.
Now I want to kind of go back, you talk about the disadvantages. Kind of the same vein, what are the advantages to going to the wrist? You talked about decreased recovery time, less pain.
Well, the radial artery is a very superficial artery. It's located in a very close space, so the bleeding almost never happens. That's number one. Number two is, again, as I said, there are studies after studies which have shown the survival benefit. The third thing is a very fast recovery time. Patient can actually walk right after their coronary angiogram, and as far as I'm concerned, my patients after angiogram, they go home within 1 hour. Even I can use the same route to deliver balloons and even deliver stents, and the patient can go home in 2 to 3 hours, so they don't have to lay in bed for 6, 7, 8 hours.
Wow. And so again, going through the groin isn't necessarily dangerous. Radial entry is just, it's more convenient and there's a lot more advantages to it.
Absolutely. Absolutely. And then, now the question is that is every cardiologist in this country is doing radial access? The answer is no. Again, as I said, it's the most common route, and is partly the reason is because the way the cardiologists were trained in the past. Partly is habit, partly is because everyone is doing it. Even we know there are clear advantages of radial over femoral artery. That's a trend that we need to change. And I would really suggest to the patients that when they walk into a cardiologist's office, and if they need angiogram for any reason because of chest pain or acute heart attack or acute heart failure, they should demand their cardiologist that they want their heart care through the radial access because of the obvious advantages.
And of course, that's something that we always stress, no matter what the procedure or type of care you're receiving, is that we want patients to be involved with their health care. So
Right.
definitely talk to your physician.
Absolutely.
Hopefully, people have learned a little bit about the advantages and disadvantages of both.
Right.
So when they come in to see you or any physicians, any heart physicians, they'll ask for radial access.
Absolutely.
Now, lot of great information. This is just one part, though, of why St. Tammany Parish Hospital ranks first in Louisiana and in the top 10% of hospitals nationwide when it comes to medical excellence for interventional coronary care, according to CareChex. That was a mouthful, but what does that mean for y'all, and what does that mean for our patients?
Well, we take a great pride. We have a great team of doctors, nurses, technical staff, cath lab staff, and this goes into the focus that we have on patient quality, patient safety, and we are number one in the state of Louisiana when it comes to the patient survival, their quality of care, their outcomes, their satisfaction, and the radial artery access is a step towards that goal. So I'm very proud of our team at St. Tammany Parish Hospital, and we will try our best to keep this tradition and keep it moving. And
the excitement doesn't stop there. I'm going to real quick. There's so many other recognitions that we got for our cardiology care when it comes to that CareChex award, top 10% nationally and in Louisiana for patient safety. For cardiac care, we're also first in the market for medical excellence when it comes to heart attack treatment, and we're also in the top 10% in Louisiana for heart attack and heart failure treatment. A lot of that is credited to our Covington Cardiovascular Care Clinic.
Absolutely, so we have a great team, and we have a great support from the community, as well as our administration. So that's a thing that we can improve on.
And we're always reporting on our website about the awesome procedures y'all are doing. If we could just briefly touch on, and we'll have you back again on our show later in the year, you're doing some great stuff with vein therapy and DVT. If you could just hit on those just real quick, we'll come back, definitely have you back on to revisit with
this.
This
is something that I've noticed that people, a lot of physicians, the patients, sometimes they really ignore when they see swelling in their feet, and they are living with that swelling and pain for years and years. So there's a condition called a venous reflux. Now there are two types of vessels in the legs: the arteries, which carries the clean blood towards the leg. Now once that blood is used by the leg, it becomes deoxygenated, and they have to flow back into the veins towards the heart. Now those veins have one-way valve, so when those valves are not working, the blood, instead of going up, it tends to pull back into the legs. That can lead to swelling, that can lead to prominent veins, pain, cramps in the leg. It's usually very common among females, and it tends to run in the families. So we have come up with this procedure that if they have venous reflux, if they have all those symptoms, swelling, edema, pain, we can actually put a small catheter into those abnormal veins and burn those veins. It's a non-invasive, it's a very low risk, minimally invasive procedure where patients can walk into the office and then can walk out within 1 hour. And it really works. Patient can feel better within a couple of hours to a couple of days.
It's so amazing, these procedures, that you can just get in and out, and the recovery time is next to none. But basically, that's what you were talking about, is varicose veins for the common person out there, and it's not just a cosmetic issue. It's actually a very dangerous health concern.
Well, sometimes you don't have to see the veins or obvious dilated veins in the legs to say whether someone has venous reflux or not. You may not see veins, but if they have swelling in the feet or pain in the legs, I would highly suggest that at least they can get a non-invasive ultrasound to diagnose that condition, and then we can take it from there.
Well, a lot of great stuff. I know we'll definitely, like I said, have you back on, get more into detail into those two treatments that we can do for cardiology patients. It's safe to say we're happy to have you and the entire team over at Covington Cardiovascular Care at St. Tammany Parish Hospital. So thanks for being with us today, Dr. Khan.
Thank you very much.
I appreciate it. And remember, you can always find out more about these and other innovative procedures on our website, STPH.org. Make sure to check us out on Facebook, LinkedIn, Twitter. Thanks for watching, and we'll see you next time.